Hello, I'm David Kerr, Professor of Cancer Medicine from the University of Oxford. And those of you who have listened to me before know that I have a huge interest in how we improve the delivery of cancer care in low-income countries. A lot of the work that we're doing in sub-Saharan Africa, in refugee camps, Syria, northern Iraq, and so on. I picked up a news article in Lancet Oncology, which I found stunningly astonishing, about the level of medical debt incurred through a diagnosis of cancer in the United States, the wealthiest country in the world. Remarkable healthcare system, some of the best physicians, the best hospitals in the world. But let me just give you some of the figures, if I may. This was a survey of around 1,300 patients, all of who had been diagnosed or treated with cancer within the past 7 years. And the survey was run by the Survivors Views Program, which is run by the American Cancer Society Cancer Action Network. What did they find? 49% of respondents stated that they were in debt as a result of being treated for cancer. A further 13% said that they expected to go into debt. Amongst those who had incurred cancer-related medical debt, 3/4 owed money to hospitals, half had outstanding bills of more than $5,000, 2/3 had owed money for more than a year, 47% owed money to their oncologist. Somehow utterly extraordinary, and even more poignantly, a significant proportion of those patients who were in debt admitted to going without food. You can imagine the mental anguish associated about the worry of repossession of homes and so on. And these debts were being pursued. There were some other bits of information that they found. For example, a 2019 analysis by the Kaiser Family Foundation Health Use found that during a 6-year period, the University of Virginia Health System had filed 36,000 lawsuits in pursuit of more than $106 million in unpaid medical bills. Our NHS, our National Health Service, has been derided in some of the election campaigns in the United States. I remember being in the States during the Obama election, in which people said vituperatively in public in these attack ads, vote Obama, get the NHS. We have universal healthcare coverage. We can provide care for every single individual, every family member in the United Kingdom to a high quality. Sure, our cancer survival figures are not perfect. They lag behind some other of the major European countries. There's more that we can do. But there's a network, a baseline of care for all of our citizens, below which people cannot fall. There's a safety net in which we gather up everyone through that sense of social community, of social conscience, and of believing that the National Health Service is government's greatest gift to individuals. Far from perfect. Much needs to be done to modernise, to reduce waste, improve value, and so on. But think of being a cancer patient, working class, lower middle class in the United States. In that survey, 98% of those surveyed had health insurance, but clearly it was leaky and there were lots of out-of-pocket payments. And just the diagnosis of cancer still being frightening, stigmatizing, and associated with that, the financial toxicity that goes on top of all the toxicity accrued by the drugs, the treatments, the surgery, the radiotherapy that we use. I was absolutely gobsmacked at these figures. We've often talked about, for me glibly, that the commonest cause of medical bankruptcy in the United States is the diagnosis of cancer. But dropping below those figures, thinking of the individuals involved, I found it shocking that the richest nation on earth doesn't have a safety net. It doesn't have a means of taking care of those citizens who who needed it. This isn't entirely a political comment. It truly genuinely is. But when we look at the United States spending approximately 20% of your gross domestic product on health care, but with issues such as this, something needs to be done, and it needs to be done in a way that unifies or brings together politicians, lobby groups, patient groups, and so on, to see if there are solutions that can be offered in a more, I'm going to say it, in a socialized medical way. Yeah, I'm astonished. And I'd be really interested in comments. There are many Medscapers from around the world. Each of us have our own different healthcare systems with their benefits and disbenefits. The NHS, far from perfect, as I say. But goodness gracious me, these figures are awful. And one would have thought that there must be a caucus, a body, a bottom-up approach from citizens in the United States who demand better healthcare generally and for cancer specifically. I'd be really interested in what you think about this, particularly our friends, our brothers, our sisters from the United States who are dealing with the thick end of this. Thanks for listening, as always. Really grateful for your comments. Medscapers for just now. Thanks for listening. Over and out. Thank you.